I will be presenting our research, which is about establishing the effectiveness of a school-based attribution training program, a sequential explanatory study. This research I have conducted along with Dr. Orancita Vilozada and Dr. Marlioni Bauyot. One of the reasons or the motivations for doing the research was actually to address the issue of adolescent depression. So it has actually become a worldwide concern, and many university students are suffering in silence rather than jeopardize their academic and future goals. So basically, some adolescents are hesitant to seek help, especially when it has to do with feelings of depression or other even stress or even anxiety. Now, the stressors that are faced by college students and adolescents um, come from different sources, and that would include financial problems, family problems, relationship problems, academic problems, and similar stressors. Now, it is more important at this time for them to be able to develop, an ability to cope with all these stressors, as well as for them to be able to manage their moods. And these become crucial, especially during college, where they have to face a lot of pressures, both academic and non-academic. Now, the school-based attribution training program was developed by Dr. Lozada to correct maladaptive attributions, to address problem solving skills, and enhance interpersonal relationship skills. Now, in the interest of accountability, she felt that it was important to conduct this study for us to be able to establish an evidence base for the study. Now, this is actually the second study that explores the school-based attribution program's efficacy on prodromal symptoms of students at a selected higher institution. Um, Now, in terms of the methods, a sequential explanatory research design was used where quantitative data was collected initially, and then it was explained. The results were then explained using qualitative data. So the quantitative component comprised of a non-randomized single group pre-test and post-test research design. A purposive sampling technique was used based on several inclusion criteria. So the first was depression and timidity scores must not exceed 80 and must not be below 60. The second is that the participant attended all 5 sessions of the school-based attribution training program. And the third was a willingness to participate in the study. So evaluation forms were also distributed after each session, and these evaluation forms included purpose and objectives, methods and design, worksheets and PowerPoint presentation, and speakers and facilitators. Now, these major headings had questions that the participants would rate on a scale of 1 to 4. There was also the use of process observer analysis, which were prepared by the research assistants and focused more on the behavior of the participants as well as the group processes involved from the first to the fifth sessions. Now, in the final session, the participants were asked to write their messages to themselves. So the messages to self, or the MTS, were submitted by them at the end of the sessions. And finally, after the sessions, a focus group discussion was conducted with the selected participants after the training program. Now, after the quantitative data was gathered, a Wilcoxon signed ranks test was used to analyze the data before and after the SBATP. or the school-based attribution training program. The results show that there were significant changes in the trustful dimension, depression dimension, the aggression dimension, as well as the gregarious dimension of the emotions profile index. The significant results show that the school-based attribution training program was effective in helping students become more trustful towards their environment. It helped lower their depressive tendencies. It helped lower their aggressive tendencies. And finally, it also increased their ability to be open to being more sociable with others. So, gregariousness becomes particularly more important, especially during college, where they would be needing more support from their friends to help buffer the um, the challenges that they face and to help buffer the effects of stressors that they are faced with on a day-to-day basis. Now, among the recommendations is that this research has contributed to further establish an evidence base for the school-based attribution program to help the development of mental health issues. However, more studies are needed to help further establish its effectiveness and using the standards set forth by the American Psychological Association, especially on establishing the evidence base for interventions. And then second, over the longer term, this program would benefit more students if this is used by guidance centers to help correct the students' maladaptive attributions, address enhance their problem solving skills and their interpersonal skills. So as a result, um, the school-based attribution program still has quite some way to go in terms of the evidence base, but the more research is done on this topic, the faster it will be for us to be able to come up with an intervention or an evidence-based intervention that will help students um, develop their problem-solving skills and have better friendships, better quality of friendships, as well as manage their maladaptive attributions. Thank you very much.